Hello everyone. Today we will be discussing about the topic apoptosis. So my learning objective will be about the definition, morphological and biochemical features of apoptosis, mechanism of apoptosis, dysregulated apoptosis, difference between necrosis and apoptosis, and the summary of the apoptosis. Before going to our topic, let's see, in a normal cell, when the cell undergoes stress, it will either there will be an adaptation, or if the injurious stimulus, it can result in cell injury. So this cell injury can be reversible or irreversible cell injury depending upon the amount of injury. So if the cell undergoes irreversible cell injury, it can result in necrosis or apoptosis, which is cell death. So coming to the definition of apoptosis, apoptosis is a pathway of cell death that is induced by a tightly regulated suicide program in which the cell destined to die activates certain enzymes that will degrade the cell's own nuclear DNA and the cytoplasmic protein. So it was first introduced in 1972 by Kerr, which is initially called as string gauge necrosis. It has been termed as programmed cell death, and also it is referred to as an activation induced cell death. So apoptosis can be seen in two situations. One is a physiological and other one is a pathological situation. So some of the example of the physiological apoptosis are the programmed distraction of the cell during embryogenesis, involution of hormone dependent tissue upon hormone withdrawal, elimination of potentially harmful self-reactive lymphocytes, death of host cells that have served their useful purposes. So cell loss in proliferating cell population, some of the cells which are lost by apoptosis in the proliferating populations are immature lymphocytes in the bone marrow and the thymus that fail to express useful antigen receptors, B lymphocyte, which is seen in the germinal centers, epithelial cells in intestinal crypts. This is done in order to maintain a constant number. So the apoptosis in pathological conditions are, examples are DNA damage. So the DNA damage is usually seen during radiation, cytotoxic anti-cancer drugs, hypoxia either directly or via production of any free radicals, or apoptosis in pathological situations like misfolded protein in a case of viral infections, or pathological atrophy in parenchymal organs after duct obstructions. So let us see what is the morphological changes we can see during apoptosis. First, the cell will undergo cell shrinkage and the chromatin will undergo condensations. There will be formation of cytoplasmic blebs and apoptotic bodies and phagocytosis of the apoptotic body by the macrophages. So what is the biochemical changes in apoptosis? So the main person who comes in action during apoptosis is the caspases. So caspase is nothing but a cysteine proteases. So it includes more than 10 members which can be divided functionally into initiator caspases and executor caspases. So mechanism of apoptosis has two phases. One is the initiation phase, other one is the execution phase. So initiation phase, it is during which some caspases becomes catalytically active, and the execution phase is during which other caspase that trigger the degradation of the critical cellular components. So initiation phase has two distinct pathways. One is intrinsic, also called as mitochondrial pathway. Next is extrinsic or death receptor initiated pathway. So first let us see what is intrinsic or mitochondrial pathway. Before that, what happens normally in a cells? In a viable cells, a growth factor will act on the receptor, for example, there will be production of anti-apoptotic protein, example BCL2, BCLX, and there is no leakage of cytochrome C. So, there is nothing happening to our cells. But what happen in case of irradiations? There is lack of survival signals. So, this can result in DNA damage, which will activate the sensors, which will antagonize the mechanism of BCL2, which is an anti-apoptotic protein, and which will activate the pro-apoptotic proteins such as back channel, which result in leakage of cytochrome C and proteins, resulting in activation of caspases leading to apoptosis. So, next let us see what is extrinsic or death receptor initiated pathway. Here the death domain binds to a Fas receptors by the stimulus by the Fas ligand, which will activate the FAD, which will result in autocatalytic caspase activations, which causes activation of pro-caspases to an active caspases 8, resulting in executional caspases activations and apoptosis. Now, let us see what is execution phase. The two initiating pathway, that is intrinsic and extrinsic pathway, will converge to cascade a caspase activation, which mediate the final phase of apoptosis. So, after an initiated caspase is cleaved to generate its active form, the enzymatic death program is set in motion by rapid and sequential activation of execution caspases. So, the most common execution caspases which come into action are caspase 3 and 6. So, it will causes cleave an inhibitor of cytoplasmic DNAs, and thus makes the DNAs enzymatically active. So, which induces the characteristic cleavage of DNA into nucleosomes and small size pieces. As a result, the DNA is cleaved. So, this caspase also degrade the structural components of the nuclear matrix and thus promote the fragmentation of the nucleus. So, this is what we have discussed. It is a picture representation of the mitochondrial and the death receptor pathway. So, I will just tell this cell injury can result in the BCL2 family sensors, and it will activate the BCL2 family effectors, mitochondrial activation, release of cytochrome C, pro-apoptotic protein, which will initiate the initiator caspase. Similarly, even in death receptor pathway, there will be adapter protein, which will activate the initiator caspases, and resulting in execution caspases. So, further there will be the breakdown of DNA by endonuclease activations, resulting in apoptosis, which will be phagocyted by the macrophages. So, how do these dead cells are removed? Okay. So, the formation of apoptotic bodies breaks the cells into bite-sized fragments that are edible by the phagocytes. So, this apoptotic cells and their fragments also undergoes several changes in the cell membrane. So, normally in a healthy cell, the phosphatidylserine is present on the inner leaflet of the cell membrane. But in apoptotic cells, this phospholipid flips out and is expressed on the outer layer of the membrane, where it is recognized by the several macrophages receptors. So, the cells that are dying by apoptosis also secrete soluble factors that helps to recruit them by the phagocytes. Some of the apoptotic bodies express thrombospodin, an adhesive glycoprotein that is recognized by the phagocytes. Other thing is, like apoptotic bodies may also become coated with the natural antibodies and proteins of the complement system, which is recognized by phagocytes. So, this process of apoptosis, phagocytosis by the apoptotic cells is so efficient that dead cells disappear often within minutes without leaving any trace, and inflammation is absent even in the phase of extensive apoptosis. So, what is the role of apoptosis in disease? Too much of apoptosis is harmful. It can result in tissue atrophy. Too little of apoptosis can result in hyperplasia. So, now with a picture, let us see what is the difference between apoptosis and necrosis. So, what happens in necrosis? In a normal cells, if it undergoes a reversible cell injury, it can result in cell swelling, that is the swelling of the endoplasmic reticulum and the mitochondria, membrane blebs, etc. So, if it recovers from this, it becomes a normal cells. But if the injury is so progressive, it results in the breakdown of plasma membrane, organelles, nucleus, leakage of content, resulting in necrosis. Here you can see the inflammatory cells around the necrotic material, but in case of apoptosis, normal cells, in a normal cells, if there is an injurious agent such as radiations or external stimuli, it can cause a condensation of the chromatin nuclear blebs, but it cannot be reversed. It will result in cellular fragmentation by the activation of caspases and results in apoptotic bodies. The cell which comes to eat apoptotic, that is the phagocytes, comes and eat this apoptotic body and resulting in phagocytosis of the apoptosis cells and fragments. So, in the summary, let me tell, organogenesis and development occurs due to apoptosis. It helps in it eliminates the cells that are injured beyond the report without eliciting any host reaction. So, my reference is from Robinson Cotton. Thank you.